Hi, my name is Claire Dubois. I'm going to be your student nurse today. My pronouns are she, her, hers, and we're going to be doing the head-to-toe assessment. Do you want to start by telling me your full name and date of birth?
Tara Pal and 10/13/2000.
Okay, let me check your wristband. Perfect. And what are your preferred pronouns?
She, her, hers.
And what would you like me to call you?
Tara.
And do you have any allergies?
No.
Okay, so before we begin with the skin assessment, I'm going to perform hand hygiene. And then I'm going to clean my stethoscope with an alcohol wipe. Okay, so first I'm going to be looking at the color of your skin. It is normal to ethnicity. It is pink. No lesions or scars. So next I'm going to palpate, and first I'm palpating for moisture of the skin. Skin is dry. I'm also going to be feeling for warmth or temperature, and the skin is warm. Next I'm going to be looking at turgor. Skin has turgor and is mobile. I'm also going to look at the fingers. Fingers are healthy, no clubbing. The fingernails are pink. I'm going to check for capillary refill. Capillary refill is less than 2 seconds bilaterally. So next I'm going to be looking at the head. So the size of the head is normal proportion to the body. There is normal contour and no deformities. I'm going to palpate the scalp. No parasites, no flaking, no lesions. Hair is thick and soft, fine, and blonde. And is there any tenderness while I'm palpating?
No.
Okay, so next I'm going to be looking at the face. It's symmetrical, and then we're going to be testing cranial nerve 5, trigeminal. So first I'm going to be testing your reaction to sharp and dull. So this is sharp, and then this will be dull. So if you could just close your eyes. Tell
Sharp.
me. Okay, thank you.
Dull. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, and then next I'm going to be doing sensitivity to light touch. So this is what it feels like. If you could close your eyes and tell me when you feel it.
When.
Okay, perfect. And then I'm going to be feeling your temporal strength, if you could clench your teeth, and then masseter strength. Okay, perfect. So both are strong. So cranial nerve 5, trigeminal is intact. Next I'm going to be doing facial nerve. Facial, cranial nerve 7. So can you smile for me, and frown, and puff out your cheeks, and raise your eyebrows. So cranial nerve 5 is intact. Next, I'm going to be looking at your eyes. So first, I'm just going to observe the eyelashes and eyebrows. No parasites. Eyebrows are full. Eyelashes are full and pointed upwards. The irises are blue. The pupils are about 5 millimeters without exposure to light. The lacrimal apparatus looks pink and healthy. I'm just going to depress the eyelids and thank you. I'm going to look at the conjunctiva. It is pink and vascular eyes. The sclera has vasculature and are white. Okay, so next I'm going to be looking with tangential light at the cornea and lens, and they are clear, no cloudiness or obstructions on that side and this side. Okay, so next I'm going to be doing cranial nerve 3 ocular motor and cranial nerve 2 optic. So first I'm going to be looking at your direct reaction to light, and then consensual, and then can you look at this pen, and then look at the wall, and then the pen, and then the wall. So that would be accommodation. So pupils are round and reactive to light directly and consensually, as well as accommodation, and that would mean that cranial nerve 2 and 3, which I stated, are intact. Next, I'm going to be looking just at cranial nerve 2. I'm going to be testing confrontation in your field of vision. So when you see my fingers, if you could just put your fingers up. Okay. Okay, so cranial nerve 2 optic is intact. Next, I'm going to be looking at your extraocular movements. So if you could follow my pen light, look up, down, side to side, and then follow it inwards. So convergence is good. No nystagmus detected through the extraocular movements. So that would mean that cranial nerve 3 ocular motor, cranial nerve 4 trochlear, and cranial nerve 6 abducens are intact. So the next thing that I'm going to do is I'm going to be looking at your nose. So if you could take off your glasses again, sorry. I'm just going to look, and it is straight midline, no deformities and no obvious swelling. It is pink. I'm going to palpate. No masses. Is there any tenderness?
No.
Okay. Next, I'm going to palpate the maxillary sinus. No tenderness.
No.
And the frontal sinus. No tenderness. No. Okay. Next, I'm going to be inspecting the nose. So if you could just lift up, and I'm looking for any septal deviation. There's none. No polyps, no ulcers, and no inflammation in the nose. So the next thing that I'm going to be doing is testing cranial nerve 1 olfactory. So first, if you could just close one nostril and blow out, and then the other blow out. So patency is good. So if you can close your eyes, and then I'm just going to hold up. You can cover one nostril. I'm going to hold up a scent, and you can tell me what it is.
Oregano.
And then the next one, close your eyes.
Cinnamon.
Yep, so cranial nerve 1 olfactory is intact. So the next thing that we're going to do is be inspecting the ears. So I'm going to be looking at the outer ear and auricle, and they're pink. They are even with the eyes, and they're proportional to the size of the head. So now I'm going to be palpating them. Let me know if there's any tenderness. Palpating the auricle.
No.
Palpating the tragus.
No.
Palpating the mastoid process.
No.
Okay. So next I'm going to be doing the whisper test. Usually I would stand 2 arms length away behind and cover my mouth, but for the purpose I'm just going to go as far as I can. So repeat after me.
ABC 1, 2, 3.
Okay, and then I'm going to come over here.
XYZ 1, 5, 4.
Perfect. So cranial nerve 8 acoustic is intact. So next I'm going to be looking at your mouth. Your lips look moist, no cracking, they don't look dry. If you could open your mouth for me. I'm just going to be looking at your teeth. They look healthy. Gums are pink and healthy. Open your mouth. The roof of the mouth looks good. I'm going to be using my pen light and looking in. Okay. The posterior pharynx looks vascularized and healthy. The oral mucosa looks good. Can you say ah when you do that? Okay, perfect. And then can you just say ah one more time? Okay, so the uvula and soft palate rise and fall was symmetrical and even with the midline. So cranial nerve 9 glossopharyngeal and 10 vagus are intact. Next, I'm going to be assessing cranial nerve 12 hypoglossal. So can you say light, tight, dynamite?
Light, tight, dynamite.
And then can you stick out your tongue? And then put it to the sky, and then put it to the ground, and then to the left and to the right. So cranial nerve 12 is intact as well. Next, I'm going to be palpating the TMJ for any crepitus, or can you open your mouth and then close it, and then move your jaw to the left and to the right, and then out and then in. Perfect. So no TMJ. And was there any pain or tenderness?
No.
Okay, so that sounds good. Next, I'm going to be inspecting the neck. So first, I'm going to have you take a sip of water as I look with tangential light at the neck. Okay, so there does not seem to be any tracheal deviation. There are no visible lymph nodes around the neck. Skin integrity of the neck is good. The thyroid is not enlarged, and there are no masses or deformities visible in this region. The next thing that I'm going to be doing is palpating all the lymph nodes. There are no visible lymph nodes as of right now. So first the preauricular, then the postauricular, then the occipital, the tonsillar, submandibular, and the submental, the posterior cervical, superior cervical, deep cervical chain, and then if you could just pop out like that, perfect. Supraclavicular. So none of the lymph nodes were palpable, which is good. Next, I'm going to have you stand up, and normally I would just come behind you, but I could not right now. So I'm going to be palpating the thyroid, the isthmus first. So if you could swallow for me, thank you. And okay, and then now the lobes. Okay, so the rise and fall of the thyroid, isthmus, and lobes were even, no masses, no deformities, and there was no pain or tenderness as you did that. Okay, so next thing that I'm going to do is I'm just going to have you raise your shoulders against me, and then look this way, and then look this way. Okay, so cranial nerve 11, spinal accessory, is intact based on what we just did. And next, I'm going to do the posterior thorax. So if you could just turn around for me. Normally your legs would be dangling off, but no worries for today. First, I'm just looking at the skin integrity overall, and it is good. There are no deformities. Shape is good, and retractions with breathing are normal posteriorly. I'm going to palpate in the 4 locations. No masses or tenderness. No tenderness? No. Okay, next I'm going to palpate or percuss. Okay, the lungs are clear to resonant to percussion posteriorly, bilaterally. Next, I'm going to just be listening with the diaphragm. As you inhale and exhale, usually would be a knot on a shirt. If you could just cross your arms for me, and then inhale deeply through your mouth for the first 2, and then the rest I'll just show the spots for today. And again. Perfect. Okay, so those were the 7 sites. And now could you please flip back around? And I'm going to be doing the same thing to your anterior thorax. So first just looking for any deformity. Skin integrity is good. Normal retractions with breathing. No abnormal shape. So now I can begin by palpating in the 3 locations. Okay, so no masses, no tenderness while I was doing that. Next, I will percuss in the 6 locations on the front. Okay, the lungs were resonant to percussion anteriorly, bilaterally. Next, I will be auscultating, and like we did last for the back, just do the first 2 and take a deep breath in through the mouth. Yeah, it's okay. Okay. The lungs were clear to auscultation anteriorly, bilaterally. Next, I'm going to be doing the cardiac exam. So we're going to start off by inspecting the precordium with tangential light. And then I forgot to say this, but for both of these assessments, we'd be laying down in the bed at 30 degrees. So I'm looking for any heaves, lifts, or pulsations. There are none. I do not see the apical pulse. It's not visible with tangential light. And now I'm going to be auscultating the 5 cardiac sites with the diaphragm. So first is the right intercostal, or second intercostal space, right sternal border aortic. Second intercostal space, left sternal border pulmonic. Third intercostal space, left sternal border Erb's point. If you could displace your breast for me, thank you. Fourth and fifth intercostal space, left sternal border tricuspid, and then over here is the apical, is where I will be taking the apical pulse. It is the fifth intercostal space, mid-clavicular line, and it is the mitral valve. And I'm taking it for 30 seconds instead of 60, and then I'll multiply by 2 for the purposes of this video. Okay, the apical pulse was 74 beats per minute. Now I'm going to go back over the same cardiac sites with the bell in order to listen for murmurs. Okay, no murmurs. Next I'm going to be taking the carotid pulse, or palpating the carotid pulse. The carotid pulse is strong and brisk throughout. Next, I'm going to be listening with the bell for any bruits. If you could take a deep breath, inhale, and then hold it. Okay, and then breathe. Perfect, so no bruits in the carotid arteries. The next thing that I'm going to be doing is the abdominal assessment. So if you could lay down for me. And normally you would not have clothing in order to hear and to view, but for now it's okay. So what I'm going to be doing is looking for contour, normal contour, any vascularization on the skin, and no visible veins, no mass is visible, no deformities, and nothing abnormal in here. So the next thing that I'm going to be doing is auscultating in the 4 abdominal areas just for normal bowel sounds. Okay, abdominal sound or bowel sounds were normal. Next thing is I'm going to use the bell to assess the abdominal aorta for bruits. So, okay, the abdominal pulse is bounding, no bruits detected. Now I'm going to palpate, and the abdominal aorta is non-palpable. So next what I'm going to be doing is percussing in the 4 cardiac sites. Okay, so the abdomen was tympanic to percussion throughout. Next I'm going to palpate for the liver. I'm just listening for dullness. Okay, and then I'm going to palpate lightly throughout for any masses. Let me know if there's any tenderness.
No.
Okay, no masses detected, no tenderness, and then I'm going to palpate for the liver, so if you could take a deep breath in and out. Okay, so the liver was non-palpable, which is good, which means it's not enlarged. So the next thing I'm going to be doing is assessing the peripheral vascular. I'm going to be just looking. I don't see any varicose veins. I don't see any arterial or vein insufficiencies. No edema throughout, no discolorations, hair is consistent, no atrophy. The nails look normal, growth and coloration. So along with that, I'm going to be testing for any pitting edema. So I'm just moving this down. If you could just bring your knees up like this. So first I'm testing the shins, Okay, no pitting edema there. Next, the dorsalis pedis. Okay, no pitting edema. And then I'm gonna look in here in the. Okay, and then right here. Okay, so no pitting edema. And then while I'm here, I'm just gonna take the pulses at the feet. So first the dorsalis pedis, then the posterior tibial. Okay, both were 2+ bilaterally. Next, I'm going to wash my hands because I was touching my feet. Next, I'm going to be doing the popliteal. I'm just going right under here. Okay, +2 bilaterally, strong pulse. Next, I'm doing the radial and the brachial. So all pulses were +2 bilaterally. The next thing that we're going to be doing is assessing range of motion. So we're going to start at the hip since we're laying down. I'm going to be palpating. First, I'm going to be inspecting all of the joints for any masses, swelling, deformities, any change in color, etc. So first, I'm doing that, and then palpating for any warmth, swelling, redness, and is there any tenderness?
No.
Okay. So now I'm going to be assessing the range of motion of the hip. So if you could bring one leg up and then put it down, and then lift the other leg up and bring it down, and I'm just gonna, can you bend this leg and then put it out to the side and then bring it back over here? Okay. Flexion, extension, and then do this one too. Thank you. Okay. Perfect. And then I'm going to hold on to this hip, and can you bring this one out? Perfect. And then I'm going to do the same over here. Okay, so flexion, extension, abduction, adduction, and internal and external rotation of the hips is good. Next, I'm going to test your strength. So if you could lift up against my hand with the hip, and then try to go against my hands. Okay, this way, this way. So 5 out of 5 muscle strength of the hips bilaterally. Next, we're going to do the knees. So if you could just bring it up all the way, that's good flexion, and then extension, and then same with this one, flexion, extension. Now, if you could press down the knee, okay, and then press up, okay, press down and up. Okay, 5 out of 5 muscle strength in the knees. So next, I'm going to have you sit, or before I did the knees, I should have palpated the joints, and I don't sense any swelling, any redness, or no tenderness.
No.
Okay, so I'm going to have you sit up like this, and then I'm going to be doing the neck. I'm just going to palpate here, okay, and then, so no tenderness, etc., what I'm looking for. Next, I'm going to have you bend for flexion, up for extension, to the left for lateral bending, to the right lateral bending, and then look over here. Rotation is good. Perfect. So next is going to be the shoulders. So if you can bring your arms up like this, perfect, and then back down. Flexion, extension is good. Then up to make a snowman, and then down, abduction and adduction is good. Make a goalpost, and then put your hands behind you. Upwards and downward rotation are good. Adduction and abduction look good as well. If you could keep your arms straight and then press up against my hands and then down against my hands. So we have 5 out of 5 bilateral strength in the shoulders. Next, I'm going to do the elbows. Or I didn't palpate the shoulders as well. Just palpating those, going back. Palpating now the elbows. No swelling, no warmth. I'm just going to do the wrists while we're at it. And then the fingers, everything looks good. Okay, so now with the elbows, I'm going to have you make a muscle and then down. And then I'm going to have you hold a cup of soup and then tip it over. So flexion, extension, pronation, and supination are looking good. And then from your elbows, can you push up against me and then down against me? So 5 out of 5 muscle strength bilaterally in the elbows. Next, we're going to be doing the wrists. So if you could go up like this, then down like this, and then in and outwards. So flexion, extension, medial, and lateral rotation of the wrists is looking good. And then same thing that we've been doing, but push against me with your wrists. Okay, perfect. And then up. Perfect. So 5 out of 5 muscle strength in both wrists. Next, we're going to do the hands. So I'm going to have you with the fingers flex, make a little fist, extension, and then adduction, spread them out, abduction, bring them back in. Next, just grab my fingers. Okay, 5 out of 5 for the finger grasp test, and then finger grasp strength, and then with your thumbs, just bring them up, back, down, and then for opposition, go to all your fingers. Okay, so flexion, extension, and opposition, and movements of the thumb are looking good. Next, I'm going to do the feet. So now I'm going to be doing the ankles, just palpating around the joints. No swelling, no tenderness. Then I'm going to be, can you flex your foot, or flex both feet, and then point them, and then can you curl your toes, and then extend them, and then can you flip your feet together, like, yeah, little internal rotation, and then a little eversion. And then next thing is the deep tendon reflexes. So while we're at the feet, I'm just going to start here. I'm going to be doing the Achilles reflex. So I'm going to be holding this and just try to relax, and you can bite down on your, like, not too hard, but clench your teeth if you need to, just to relax. Okay? Okay, so the Achilles deep tendon reflex was +2 bilaterally. And next, now I'm doing hand hygiene because I was touching the feet. Next, I'm going to be assessing the patellar reflex. Okay? Okay, the patellar reflex was +2 bilaterally. Next, I'm going to be doing the brachioradialis. Can you just try to relax as much as possible?
Right.
You just flinched. That's okay. 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 The brachioradialis is +2 bilaterally. Next is the biceps. Okay. Okay. The biceps is +2 bilaterally. Just relax your arm as much as possible. Okay. The triceps. Well, we haven't done this one yet. Just relax.
Sorry.
It's okay. Okay. The triceps are +2 bilaterally. I think that's everything. Your muscle bulk is good. No fasciculations, no tremors. Overall tone is good. I'm going to check my cards. There were also no masses and hernia in the abdomen. And no crepitus while I was palpating. And lastly, can I just have you lay down? And I just,
The camera.
huh?
The camera.
Yeah, thank you. I just want to take the femoral pulse, which I forgot. So I'm just going to go right here. Okay, femoral pulse is strong, and then I'm going to do the inguinal lymph nodes. So I'm just palpating along here for those. Okay, and then I didn't palpate the inguinal lymph nodes. So now I'm going to remove my gloves, perform proper hand hygiene, and I'm done with the physical assessment.